Hi, everybody. Thank you so much for taking time out of your busy day to come and have a conversation with me, or I guess to listen. I wanted to take a moment just to introduce myself. I think that some of you that are listening now may have run into my name, seen me published in the American Chiropractor, Dynamic Chiropractic, or in various other places. But I think it's important for me to introduce myself a little bit more formally, typically because there's going to be a lot more information that's going to be coming out through social media and through the web. And I want you to understand that these are things that I'm sharing with you that I'm experiencing. So I want you to think of me more as a conduit to information as opposed to somebody that's just processing something on their own. For me, experience is really a key component to how we see our lives, how we see our practices. And it's not just the personal side. I think it's the experiences of others. And because of how my practice is structured, I think that I can really give you all a unique opportunity to see inside how medicine is practicing and where the healthcare system is really going. More often than not, what we're experiencing right now is information with a political twist. So what we hear about healthcare is really about the different political factions, and the information or misinformation is really difficult to use when we're trying to grow our practices and really care for our families and our patients. So my experience has really been focused more on the academic side of things. And I want to give you a look into sort of what's happening in medicine from an academic side, and also share with you what my credentials are, which gives me sort of a unique opportunity to report to you. And that's really sort of what we're doing. So just some background on me. I've been in practice for 20 years. My primary focus in practice is biomechanical spine pain. So really it's focused on chiropractic assessment and chiropractic adjustment. Now, I went to National College. I graduated in 1997. And our focus was really on a diagnostic sort of general care paradigm. However, the more that I got to work and meet with the medical community, the more that I realized that chiropractic's niche is more important now than ever. So my focus in practice really moved towards that sort of model. I have two associates that work with me in the office here. I'm in Buffalo, New York, right in the city. I'm down the street from the medical campus. So you might hear on the news of the Buffalo Niagara Medical Campus. That's right where we're at. Now, I also hold faculty positions in 3 chiropractic colleges in the postgraduate department. And I also hold a faculty position in family medicine at the State University of New York at Buffalo, Jacobs School of Medicine. And that allows me to work at a clinical side and a clinical instructor aspect with family practice residents. I do lecture to 3rd and 4th year med students. However, that's sort of maybe the one bookend. And then the other bookend would be the residents. And some of these residents, a month after they see us in our clinic, are going on to take their boards and they're being released into practice. So our goal was always for them to be able to, in their 3rd and 4th year, get some basic training and understanding as to the scope of biomechanical or mechanical spine pain. They also refer to it as nonspecific. Chiropractic historically is called that subluxation, right, or partial dislocation. So all those words sort of mean the same thing. However, we use different language, and that's part of one of the communication barriers that I'll allude to in subsequent recordings. But one of the most important aspects of my faculty position is that doctors that work with me, or doctor student, as a matter of fact, we all can present continuing medical education lectures to primary care doctors and medical specialists. So one of the ways that we really reach out to the medical community and promote what we're doing academically is through continuing ed. And that'll be something that I talk to with you guys about in additional YouTube videos. So the academic approach is important. I'd also like to note that I was the first chiropractor to be selected, and the first chiropractor, and as far as my knowledge, is the only chiropractor that has gone through the Royal College of Physicians Certified Physician Educator Program. And that's a lot of words, but the Royal College is a organization out of the United Kingdom. And that organization is really focused and chartered, or I guess their mission is to help graduate level medicine to evolve. And what that means is the residency programs and fellowship programs. What happens once a medical student graduates their 4 years and now they're put into the clinical setting? And any medical doctor will tell you that 95 to 98% of all knowledge in medicine is learned on the job. So kind of like an apprenticeship. But typical residencies are about 3.5 years, and then fellowships are 1 to 2 years on top of that, which is specialized training. So the Royal College travels the world, and what they do is they work with clinical instructors. Just like when we went through our internships, we had attending chiropractors, or we had our clinical directors, and we had those doctors that guided us. That's the same thing, except that medicine is obviously focused on treating different ailments, mostly internal medicine disorders, where we're focused mostly on the mechanics of the spine. That organization, the Royal College, puts on a 1-year program, which I was part of, that teaches you how to be a clinical instructor. So when you're working with the patient and you have a student or multiple students, how do you give the patient what they need? How do you attend to the student? And how do you keep yourself from going nuts? And how do we do that all in an academic environment that has a clear and distinct pathway? So that was about a year process. I had 2 projects that I had to complete, and the one project that came out of this, the one big project that came out of this is the fellowship program that I direct. And I direct a fellowship program in spinal biomechanics and trauma, which is something that, again, I'm going to get into. So if you're looking for additional training, this is what came out of the Royal College, and I saw it as a gap in education in chiropractic graduate studies. And it's opening a lot of doors for a lot of doctors around the country. And if you're interested in the next level, you'll see these videos coming out, and you can obviously contact me. So with that being said, what I really want to introduce you to is the fact that the primary care community is really looking for help on managing spine cases. And we haven't done a really good job historically, as you can see by news articles, research papers. And chiropractic is really in the best position to offer that help. So when it comes to you getting information from the inside, that's what I'm bringing you. I'm bringing you the ability to understand the hoops that medicine is going through to try and train their new doctors with an understanding that there's a collaborative effort with spine care. So I hope that's a quick introduction. I hope you learn a little bit more about me, and stay tuned for more information, because I'd love to share what's going on in my community and certainly in healthcare in the United States, because this is probably some of the best timing for the chiropractic profession if we align ourselves properly with the academics and the research and become teachers as opposed to just clinicians. Thank you so much for joining me.